This is The Rounds Table.
Welcome back, Rounds Table listeners. This is John Fralick, one of your hosts. Today we're doing a solo episode. This is a paper called The Mediterranean Diet for Irritable Bowel Syndrome, a randomized controlled trial. This was published in the Annals of Internal Medicine, October 2025, by Bamidelli et al. So the research question here was to determine if the Mediterranean diet is non-inferior to traditional dietary advice in managing IBS symptoms. Why is this important? Well, IBS is a common disease affecting 5 to 10% of the population. As an internist, often IBS is on our differential for some patients we see for GI-related symptoms. Guideline recommendations around dietary optimization for treatment include using traditional dietary advice, in particular eating a balanced diet and healthy eating patterns. About 40% of patients tend to respond to this, and if a non-responder, then typically dietary advice is escalated to a low FODMAP diet, which has a response rate of about 50 to 70%. We've talked about the Mediterranean diet before, and there is some limited evidence to suggest symptom improvement in patients with IBS. So here, the authors set out to conduct a randomized trial to directly compare the Mediterranean diet with traditional dietary advice. So what was the study design? This was a non-inferiority randomized trial done in the United Kingdom from October 2023 to December 2024. For the patient population, it was adults aged 18 to 65 who fulfilled the Rome-4 diagnostic criteria for IBS with an IBS symptom severity score of 75 or greater and who were English literate. There were a number of exclusion criteria, including those with low BMI of less than 20, a history of an eating disorder, current dietary interventions including low FODMAP diet, traditional dietary advice, gluten-free or Mediterranean diet, as well as a number of other exclusion criteria. Patients were randomized 1-to-1 to either traditional dietary advice or the Mediterranean diet. Patients were stratified by severity of IBS and by subtype, that is, diarrhea predominant, constipation predominant, or mixed. Traditional dietary advice entailed recommendations to adopt sensible eating habits, including avoiding excess fatty food, spicy food, processed food, caffeine, fizzy drinks, and alcohol. For the Mediterranean diet, the focus was around a diet rich in fruit, vegetables, legumes, whole grains, nuts, fish, and olive oil. For the intervention, patients were specifically invited to attend an online group session with up to 4 other participants in the same dietary group intervention. The session lasted 30 minutes and participants were then emailed supporting information regarding their particular diet. At the time of randomization, patients were only told that they were randomized to diet A or B, and then it was during the session that the specific diet was disclosed. Participants did not know what the other comparison diet was until the end of the study trial. Participants were followed over 6 weeks and completed a number of questionnaires. The primary endpoint was based on symptom improvement using the IBS Symptom Severity Scale, where a 50-point or greater reduction is considered to be clinically significant. Adherence to the diet was based on self-report as well as a questionnaire called the Mediterranean Diet Adherence Screener, and data was analyzed using a modified intention-to-treat analysis. So who was included in the study? 168 participants were randomly assigned between the two groups, and of these, 142 attended the assigned education session. The average age was 40, 80% were female, the majority were white, 54% had severe IBS, with the majority, or 48%, having a mixed pattern subtype. So what did they find? After 6 weeks, there was a greater improvement in IBS scores for patients randomized to the Mediterranean diet. Specifically, 62% of patients in the Mediterranean diet versus 42% in the traditional diet group had a 50-point or greater reduction in their IBS symptom severity score. This result was both non-inferior as well as superior. For some of the secondary outcomes, diet satisfaction was similar between the two groups. With some of the subgroup analysis, they did show that patients with severe IBS were more likely to note improvement in symptoms. So what were some of the limitations here? Well, this was a small study with short outcomes only up to 6 weeks. Participants weren't blinded, which could have impacted self-reporting of outcomes, but to try to work around this, participants were initially only told that they were randomized to diet A or B, and then only told about the specific details during that online session. It was only at the end of the study completion that they found out what the comparison diet was. So what's the takeaway? Well, the Mediterranean diet was associated with improvement in IBS symptom severity scores compared with the traditional diet. Is this practice changing? It's a small study, but we already know the benefits of the Mediterranean diet for a number of other disease states, and patients with IBS can really suffer with their symptom burden. This fairly straightforward intervention seemed to lead to significant and meaningful short-term improvements for patients. Well, that just about wraps up today's episode. But before we go, the good stuff. We've talked about some studies that apply to AI in medicine, but I really have no background understanding of what neural networks and large language models actually mean or do. There's a YouTube series by a guy named Grant Sanderson who publishes educational videos under the name 3 Blue, 1 Brown. One of his series is about neural networks and large language models, and it digs into the math behind AI in a way that's quite approachable. And with the help of great graphics and an excellent educator, the videos attempt to make some of the fundamentals a bit more understandable. There's a bunch of videos in the series, but the first one's called But What is a Neural Network? I highly recommend checking it out. All right, well, thanks a lot for listening. Talk to you next time. The Rounds Table is hosted online at medicinepods.com, your one-stop source for comprehensive internal medicine education and evidence-based medicine resources. We can also be found on all of your favorite streaming services. You can also follow us on Instagram, LinkedIn, and X.